This is the mediastinum. The superior mediastinum extends from the thoracic inlet down to the level of the sternal angle, and from the manubrium anteriorly to the upper four thoracic vertebrae posteriorly. So the whole region above the heart is the superior mediastinum. It contains blood vessels, the trachea, the esophagus, nerves and lymph nodes. The part of the mediastinum below the sternal angle is divided into the anterior mediastinum, which lies in front of the heart, the middle mediastinum, which is occupied by the heart and pericardium, and the posterior mediastinum, which is the part behind the heart and the pericardium. Right side of mediastinum. The root of the lung and the arch of the azygous vein form the key to this service. This is the root of the right lung. It is formed of the principal bronchus posteriorly, the pulmonary artery just in front of the bronchus, and the two pulmonary veins. The superior vein is in front of the artery, and the inferior vein is below the bronchus. The rest of the lung enters the hilum of the lung. The root of the lung enters the hilum of the lung. This is the arch of the azygous vein, arching over the root of the lung to end in the middle of the superior vena cava. The azygous vein is seen passing on the posterior chest wall behind the heart and the esophagus. It receives the posterior intercostal veins of the right side. This is the superior vena cava. It begins by the union of the right and left brachiocephalic veins and ends by opening into the right atrium after piercing the pericardium. It is joined by the azygous vein. Notice the phrenic nerve as it descends on the surface of the right brachiocephalic vein, the superior vena cava, the pericardium covering the right atrium, and below on the inferior vena cava. It is accompanied by the pericardico-phrenic artery, which arises from the lateral thoracic artery. This is the right atrium. It forms the whole right side of the heart. This is the inferior vena cava, which is a very short segment inside the chest. That is to say, after it pierces the diaphragm. This is the trachea, lying above the arch of the azygous vein with the vagus nerve on its side, and the esophagus lies behind it. The vagus nerve runs downwards and backwards deep to the arch of the azygous vein to come behind the root of the lung. then continues to the esophagus. Compare this course with that of the phrenic nerve, which runs in front of the root of the lung. This is the esophagus, lying behind the trachea. It is overlapped on its right side by the arch of the azygous vein, then continues downwards and to the left of the midline to come on the right side of the descending aorta, then crosses in front of it to come on its left side. This is the sympathetic chain. And this is the greater splanchnic nerve. Now it is better to see the impressions of the right side of mediastinum on the right lung. This is the mediastinal surface of the right lung. This is the hilum of the lung, showing the structures of the root of the lung cut in section. This is the principal bronchus, most posteriorly, and is hard when fed due to the presence of plates of cartilage in its wall. This is the pulmonary artery, just in front of the bronchus. This is the eparterial bronchus, which lies just above the pulmonary artery. This is the superior pulmonary vein in front of the artery. It is the most anterior. This is the inferior pulmonary vein below the principal bronchus. It is the most inferior. The pulmonary ligament is a fold of pulmonary pleura that extends below the hilum. This white membrane is the pulmonary or visceral pleura. To identify the structures in the hilum, start with the most posterior opening, which is the bronchus. Then the most anterior is the superior pulmonary vein, and the artery is in between. The most lower is the inferior pulmonary vein. This is the groove for the arch of the azygous vein, just above the hilum. This vertical groove is for the right brachiocephalic vein and the superior vena cava. The area above the arch of the azygos is related to the trachea and esophagus. The trachea is in front of the esophagus. The area in front and below the hilum is for the right atrium. The area in front of the superior vena cava is for the upper end of the ascending aorta. The inferior vena cava forms a notch on the inferior border of and in line with the superior vena cava. The area behind the hilum is related to the azygous vein and the esophagus. The esophagus is in front of the azygous vein. This is the left side of mediastinum. The root of the lung and arch of the aorta form the key to this surface. The arch of the aorta arches over the root of the left lung, similar to that of the arch of the azygous vein on the right side. The arch is continued behind the root as the descending thoracic aorta. It descends in contact with the left side of the thoracic vertebrae, starting opposite the fourth thoracic vertebra. As it passes downwards, it deviates to the right and is crossed by the esophagus, which deviates to the left. Notice the posterior intercostal arteries as they arise from the dorsal aspect of the thoracic aorta. These branches begin by the third posterior intercostal. The first and second arise from the superior intercostal artery, which is a branch of the costo-cervical trunk. On the left side of the arch of the aorta, notice these important structures: the left vagus nerve, the left phrenic nerve, the cervical cardiac nerves, and the left superior intercostal vein. This is the left vagus nerve. Here it gives off its recurrent laryngeal branch, which winds round the arch of the aorta. The vagus continues behind the root of the lung to reach the esophagus. This is the left phrenic nerve, running on the side of the arch of the aorta, but it passes anterior to the root of the lung. It is accompanied by the pericardiaco-phrenic artery. It continues on the pericardium opposite the left ventricle, then it pierces the diaphragm below. These are the cervical cardiac branches, which arise from the left vagus and left sympathetic trunk in the neck, and descend to join the superficial cardiac plexus of nerves on the surface of the ligamentum arteriosum, just below the arch of the aorta. This is the left superior intercostal vein, ascending to end in the left brachiocephalic vein. This is the ligamentum arteriosum, connecting the undersurface of the arch of aorta to the left pulmonary artery at its origin from the pulmonary trunk. It is the ductus arteriosus of the fetus. Notice the recurrent laryngeal nerve as it winds below this ligamentum arteriosum to ascend in the superior mediastinum between the trachea and the esophagus. This is the left recurrent laryngeal nerve, ascending between the trachea in front and the esophagus behind. Note that the right recurrent laryngeal winds around the right subclavian artery. This is the thoracic duct as it ascends on the left side of the esophagus. It reaches the root of the neck to end in the junction between the left internal jugular vein and the left subclavian vein. This is the left internal jugular vein, left subclavian, and this is the end of the thoracic duct. This is the right vagus nerve, giving off the right recurrent laryngeal nerve, which winds round the right subclavian artery. The right subclavian artery arises from the brachiocephalic artery opposite the sternoclavicular joint. The other division of the brachiocephalic artery is the right common carotid artery. This is different from the left side, where both the left common carotid and left subclavian arise separately from the arch of the aorta. This is the brachiocephalic artery arising from the arch of aorta. To its left side is the left common carotid and left subclavian. This is the left common carotid artery, and this is the left subclavian artery. And both lie on the left side of the trachea, separating it from the lung. In front of the origin of these three arteries lie the left brachiocephalic vein. This vein runs obliquely from left to right. It arises by the union of the left internal jugular vein and the left subclavian vein, and ends on the right side where it joins the right brachiocephalic vein to form the superior vena cava. It receives the inferior thyroid veins, which drain the isthmus of the thyroid gland. All these vessels lie in the superior mediastinum. They are covered by the thymus gland. This is the thymus gland, which is well developed in children than in adults. Remember that the whole arch of aorta is in the superior mediastinum, that's to say, behind the lower half of the manubrium sterni. Now, it is better to see the impressions of the left mediastinum on the left lung. This is the hilum of the left lung. As in the right lung, start with the most posterior opening, which is the principal bronchus. The most anterior is the superior pulmonary vein. The most lower is the inferior pulmonary vein. The pulmonary artery is between the bronchus and the superior pulmonary vein, but it overlaps the bronchus from above. There is no eparterial bronchus as in the right lung. This is the groove for the arch of the aorta, above the hilum. It is the groove for the descending aorta behind the hilum. In front of the lowermost part of the groove for the aorta, there is an impression for the esophagus where it deviates to the left and crosses the aorta. In front and below the hilum, there is the concavity for the left and the right ventricles, and just above this concavity is the area for the infundibulum of the right ventricle. Just above the arch of the aorta is the area for the common carotid and left subclavian arteries, where they overlap the left side of the trachea.